All right, well, with confusion swirling over the implementation of Obamacare, another government agency is trying to get the word out. Veterans Affairs launching a huge new outreach campaign, a website that vets can visit to learn about the law and how it will affect them. But a lot of analysts wonder if the department is up to the job. Pete Hegseth is the CEO of Concerned Veterans for America. Oliver North is a retired lieutenant colonel of the Marines and a Fox News military analyst. Gentlemen, thanks for being here.
Thanks for having me.
Pete, let me start with you. So the VA has started this new awareness campaign for veterans to educate them on the benefits of the Affordable Care Act. What do you think veterans need to know about what if anything, is changing?
Well, I'll tell you, veterans, they've already seen Obamacare. We've looked into the future because we've experienced the Department of Veterans Affairs, a place where there are wait times and backlogs and accountability nightmares. We've seen what government health care looks like. And it isn't always the care. In many of these VA facilities, they provide great care once you get into the door. It's the impediments to entry and the waits and the bureaucracy that we will get from healthcare.gov. And I don't understand why we're trying to pull veterans and convince them to enter yet another government system or their families. Veterans understand what government health care looks like, and in this case at VA, it isn't looking very good.
Okay, well, here's what the administration says is the benefit. There are 1.3 million veterans and almost 1 million spouses and children, Colonel North, who are without health insurance, and so the Affordable Care Act is designed to be the cushion for those folks, which obviously would be a comfort to them, I would imagine.
As Pete just said, and he's dead right, we have seen the consequences of some of this, because some VA medical centers are first class, like the one in Richmond, Virginia, but many are not. And second of all, the families of veterans are not covered, and there's over 20 million of them.
But with the Affordable Care Act, Colonel, they will be. That's the point, they say, of the Affordable Care Act.
But will they be well served?
Exactly. And the problem is that there's a lot of wrinkles in the fabric of the VA. The propaganda that they're putting out right now about Obamacare fails to mention the breaches that have already occurred in the so-called inadvertent release of millions of veterans' Social Security numbers. So if the U.S. government cannot protect the Social Security numbers of people like me who receive a VA disability check, how are they going to protect the sensitive health records of every single American citizen? The Obamacare Data Hub is going to be ground zero for all kinds of hack attacks, from criminals, foreign attacks, and potential political extortion. And this, for me, this is very personal, and I want to make sure that you understand where I'm coming from. If the IRS can compile an enemies list of organizations and donors, what's to say the administration won't poke into the medical records of individual political opponents? In my last book, Heroes Proved, the president does just that. And for me, this is very personal, because everyone, not just vets, ought to be concerned. When I was being investigated by a special prosecutor, they released portions of my medical record from the military that they'd subpoenaed, and they gave it to the press in an effort to destroy my credibility and bring down Ronald Reagan. Now, I will tell you, that's the kind of thing that we're all going to be subjected to, not just veterans.
Yes.
So, Pete, what I hear you both saying is that it is a crying shame that military spouses and children are not covered, but that you fear that the bureaucracy and the security risks of Obamacare will be too much to cover up that.
Absolutely. The IG at Health and Human Services has already said they haven't been able to test this system well enough to know whether they'll be able to protect this private data, as the Colonel said. But you know what, to take it to another level, this is a fairness issue. So we're encouraging military families and others to join Obamacare, while politically well-connected businesses, unions, and the folks who wrote the law and passed the law have just exempted themselves and written themselves out of it because they know how it's going to manifest itself. Yet we're promoting it toward veterans and military families, knowing the data risks, knowing what we've seen at VA when the government takes over health care. I think it's a very disingenuous attempt, like they've been using celebrities and others to make the case for the affordable. It's a marketing ploy that doesn't actually deliver good care to veterans or their families.
Colonel North, in 10 seconds, what is the answer then for the people who are uninsured?
Well, the answer was to go out and get insurance. I mean, if we hadn't made it so doggone expensive to do so, my policy's gone up, so have your premiums. I mean, all of us have. And what they've done is they've already started to wreck the system. It's got to stop.
There are other reforms
implement it.
that we can bring that cost down. The Affordable Care Act has already shown it's not going to do that.
All right, gentlemen, thanks so much for bringing your concern and sharing it with us. Pete Hegseth, Colonel Oliver North, great to talk to you.